Gender-based violence has become an issue of grave concern at international, regional, and national levels. Despite the efforts of the United Nations, this scourge continues to take a massive toll. Nigeria is a signatory to a number of international and regional treaties and/or conventions. It has also adopted a national legal framework to protect its citizens against gender-based violence. Now, according to the Global Database on Violence Against Women, 22.3% of women in Nigeria experience lifetime physical and/or sexual intimate partner violence, while 43.4% of young girls are victims of child marriage and 19.5% of young girls are victims of female genital mutilation. Well, Dr. Kemi Dasilva-Ibru is a specialist healthcare physician who is dedicated to improving the lives of women and girls through medical practice, social activism, and a wider public advocacy against gender-based violence. She joins us now to dwell on this problem for just a while. Now, let's talk about let's take it back a bit and talk about what inspired you to start WARIF. You know, it's an organization that really fills in the gap when it comes to, gender-based violence. So what was it about that subject matter for you that made you go down this path?
Well, let me start by saying hello and
Hi.
Thank you for having me.
Of course.
My background is healthcare, so I'm a specialist obstetrician and gynecologist. So my patient audience are women. And following my postgraduate training, I moved back to Nigeria and I started working in the public sector. And this was many years ago, over 15 years ago. And this is when I started to see disenfranchised girls and women being brought into public sector facilities, enduring horrific acts of violence. But unfortunately, especially back then, didn't have any specialized care or centers for them to visit. And so one would offer their services as best as you can, pro bono, but being an OBGYN specialist, my intervention was with the extreme cases. And there's a wide range between a woman needing operative intervention and her being abused at home on a daily basis. And as you rightly said, there was a gap that needed to be filled. And I felt compelled at that point in time to do more by creating a vehicle that would offer fully survivor-centered services beyond just healthcare.
So what are the statistics like regarding gender-based violence in Nigeria, you think?
In Nigeria, our statistics are horrific. We're dealing with 1 in 4 girls before the age of 18 would experience at least one violent sexual encounter. And 70% of them, oftentimes more than one. And to put that statistic into context, we're a population of over 200 million people. 100 million of us are women. Yeah. And we're a young country, so over 60% of us are under the age of 24. That's over 10,000 girls every day. And with boys, the statistics is 1 in 10. And so for every 1 in 4 girls, you have 1 in 10 boys being violently abused on a daily basis somewhere in Nigeria.
I think just last week on the morning show on the weekends, we had 2 survivors of gender-based violence. In fact, theirs went to the extent where they were taken out of the country and, made to do unspeakable things.
They were trafficked.
Yes, they were trafficked. But as someone who has been leading this cause, what would you say has been the most prominent, case that really, maybe seared a memory in your mind? One of the most, I would say, prominent themes in the cases that you've had to manage?
For me, I don't think of the girls that we treat, the women that we encounter, as prominent cases. Every case is prominent. At the WARIF Rape Crisis Center, we started to offer free services in early 2017. We're almost up to 5,000 beneficiaries, and the youngest is 7 months of age.
What?
That's prominent. The oldest is in her 70s. That's prominent too. And so are the other thousands of cases that we see. For me, I think what's relevant and what we should focus on are the social drivers. Why are we seeing these cases? Why is a young child enduring this case at home? And we live in a country, a low middle income country, that we know is, pardon the reference, but it's subjugate. Women are subjugated, if you know what I mean. There is that male dominance that we see across the board. And unfortunately, we have harmful practices that encourage this violence against men and women. And then you look at the bigger intersections, you wonder about our laws, which we have great laws, but are they being adequately implemented? Look at the healthcare. Do we have sufficient essential services? And then you look at the political will, and you think to yourself, well, do we have cohesion? Do we have like a gender bill across all the 6 geopolitical zones that are actually there to defend women and girls?
In all the gambit of the challenges you've just highlighted, so what has been the response to the establishment of WARIF and, of course, the government's response to your cause as well?
Well, we have a wonderful relationship, I would say, with Lagos State. Lagos State has one of the progressive states, a domestic violence sexual agency, and we happen to be an official partners of this agency. But I mean, beyond that, many of the states, including Lagos State, happen to have sexual assault referral centers. And these are specialized centers that cater to the needs of survivors. In over 19 states, we're now up to 35 of these centers, including the WARIF centers being a non-profit. We have specialized courts now that deal with these cases. I believe we're up to almost 11 now in at least 5 states, including Lagos State. And then we have laws that have been amended, specifically the Violence Against Prohibition Act, which was amended in 2015. And this has now been domesticated in 34 out of the 36 states. And so there is movement. It's just not enough, and certainly not fast enough, because when we look at the gender parity in this part of the world, we're told it's going to take a whole century for us to achieve parity.
Wow, thank you so much for that. I mean, I was just taken aback when you had even mentioned that the youngest was 7 months. Yeah. And even in giving the statistics, you've spoken about how 1 in every 4 girls faces sexual violence and 1 in every 10 boys faces the same fate. And the acronym of your initiative clearly says women. But are you open to supporting male survivors as well?
Oh, absolutely. I mean, the acronym states women unapologetically so. I mean, we're women-facing, we're women-led. I mean, as I mentioned, my background is with that particular patient population. But gender-based violence is just that. Regardless of one's gender, you are at risk as a result of your biological sex or, gender as it's determined. And so both men and women, both boys and girls, are welcome. But the reality is, because of the fact that we recognize that more girls are at risk than boys, and based on my particular specialty, is why I make the decision to focus first and foremost on that particular group.
Very good. So we're in a 16-day activism period. How can people know about gender-based violence at this rate?
Well, 16 days of activism is an annual event. It's a UN event where organizations like myself, both governmental and non-governmental agencies, and individuals use this period to highlight events and activities addressing gender-based violence. One of the activities that we run on an annual basis is a no-tolerance march. And this is an event that's held across many cities in the world, recognizing that this is a global issue, but highlighting it through the African lens and through the Nigerian lens. And so we hold our march on the first Saturday of each year. So this year is this Saturday, tomorrow, December 2nd, at 7 a.m. in Lagos and Abuja and in Abeokuta, which are the cities that are held in Nigeria. But as mentioned, we're also in Accra, we're also in Liverpool and London and New York, LA, and so on. So based on the different time zones, the marches started on that same day. And so throughout the course of the day, we have different groups of people coming out, standing with WARIF, addressing the issue and saying no tolerance, enough. Let's stop the violence, let's stop the rape, let's stop the child abuse.
Definitely. Dr. Kemi, there are a lot of people, watching right now, and I'm confident that probably a few of these people would be survivors, suffering in silence. How can they reach out to you, reach out to your organization if they want to share their stories?
Well, the first thing I want to say to every survivor is that it is not your fault. Women, men, boys and girls are made to carry the weight of this act because society ostracizes them, forces them to remain silent. And then they carry this act until, unfortunately, they either can't deal with it anymore and they may self-harm, or they have to have outlets in different ways, susceptibility to all sorts of vices. I ask every survivor to please make their way to the Warif Rape Crisis Center. It's at number 6 Turton Street off Thurban Avenue in Yaba. All our services are free. We're open 6 days a week, including every public holiday. I also ask every survivor to call our free 24-hour toll-free helpline, 0800 02910 0009. I don't know if it's something that you can put up.
You can just repeat it one more time.
So it's 0800 9210 0009. Should I repeat it one more time? 0800 9210 0009.
Thank you.
So please call, please visit. We're here to help.
Definitely.
Right, on that laudable note, we'd like to thank you, Anita Kemi Dasilva-Ibru, consultant specialist of obstetrics and gynecology, founder Women and Risk International Warif. It's good to have you with us.
Thank you so much.